How's it going, everyone? Today we will be finishing up our conversation on the peripheral circulation. We're going to talk about baroreceptors, which are receptors located in our blood vessels and in our heart that help pick up on changes in blood pressure and help the nervous system respond to changes in blood pressure. Today we're going to be learning about two different groups of baroreceptors. And baroreceptors are a subclass of mechanoreceptors. Mechanoreceptors pick up on differences in mechanical pressure and distortion. And so the baroreceptors are located within our blood vessels and in our heart and help to pick up on changes of stretch within those vessels. And this will be an indicator of changes in pressure in these different vessels. So the first group of baroreceptors that we'll be discussing today are the arterial baroreceptors. And these are located in the aortic arch and in the carotid sinus. And if you think about these locations, they're pretty important as far as monitoring the amount of blood pressure on the arterial side. The aorta, obviously, is where blood first enters the systemic circulation from the left ventricle. So having baroreceptors here will, make sure that pressures are constant for the arterial blood that's entering the circulation. And then the carotid arteries help to bring up oxygenated blood to the brain. And the brain being, one of our most vital organs, it's important that we make sure that pressures of arterial blood are constant heading towards the brain. The baroreceptors are going to pick up on changes in stretch. And so if there is an increase in stretch, that means that there is an increase in pressure. And if pressure is increasing, there is going to be an increase in the frequency of messages sent along the glossopharyngeal nerve from the carotid sinus, from these baroreceptors, to an area of the brain called the nucleus tractus solitari, or NTS. And this is the primary cardiovascular control center located within the medulla. And so if there is an increase in pressure and stimulation of the NTS, what's going to happen is that the response is then going to inhibit sympathetic nervous activity. And this is known as the depressor response because we are decreasing blood pressure by decreasing sympathetic nervous activity. When you decrease sympathetic nervous activity, there's a lower heart rate, there's a lower stroke volume, and then there is a passive release of vasoconstriction or vasodilation, which will help to lower total peripheral resistance and then therefore lower mean arterial pressure. The feedback works in the other way as well. If there is less stretching, well, then there will be less frequency of messages sent to the brain. That is registered as a decrease in pressure, and then sympathetic nervous activity would then increase in order to restore mean arterial pressure. The carotid baroreceptors are more sensitive to absolute changes in blood pressure than the aortic baroreceptors. We see this in the signaling done by both groups of baroreceptors if pressure is altered, and then we see the response is greater in the carotid baroreceptor signaling than it is for the aortic baroreceptors. However, they are both equally sensitive to changes in pulse pressure, so that pulsatile pressure changes. And so typically they are both going to respond to changes within that pulse pressure. Remember the difference between systolic and diastolic pressure. Now, again, the carotid baroreceptors may be more sensitive due to their location. They are located in the carotid sinus, within the carotid artery, and again, that helps to bring oxygen to the brain. We could see in the figure how the baroreceptors really are going to change their activity in response to fluctuating pressures. If you look at, let's say, a constant pressure, let's use 100, which is near the average mean arterial pressure, the most signaling occurs in this early systolic phase when you get a big jump in aortic pressure from that resting phase to that ejection of blood. And so that buildup in pressure, you're seeing a lot of signaling sent from these baroreceptors. And then as, pressure is held more constant, and then decreases, that frequency becomes less and less and less. And so, again, the blood pressure within the carotid artery and the aorta is signaled through those frequencies to the medulla. So the lower the pressure, the lower amount of frequency, but then as pressure increases, that frequency of action potentials is going to increase as well. And this is basically the code for the brain to know what is going on in our peripheral circulation, whether pressure has increased from its normal or it has decreased from its normal. The arterial baroreceptors display what's called adaptation, and when there is a constant stimulus, they become less responsive, less sensitive to that stimulus. And so we'll talk about in a second that basically your brain, your medulla, is going to have this set point as far as mean arterial pressure is concerned. And then, so as we sit here, our brain is registering a mean arterial pressure. On average, across most people, it's 93.3, right? And so your brain recognizes that as its set point. And so the activity, as long as your, blood pressure remains around that constant level, there's not going to be much change that occurs. And so what happens is, though, we know in our arterial blood that there is a change in this pressure, especially in the aorta, because of the phase of the heart. And so that's what brings about the pulse pressure, the differences in systolic pressure versus diastolic pressure. And so really the baroreceptors are monitoring the changes and the pressures both during the systolic phase and this diastolic phase. And we can see in this figure to the right here that, again, under normal conditions, we have the systolic and diastolic pressure. And then once that pressure difference is eliminated, well, then the frequency of firing by the arterial baroreceptors is going to decrease. So by decreasing pulse pressure, that's decreasing signaling to the medulla. And so that is going to basically translate in the brain that mean arterial pressure is low. And so since this works as a negative feedback loop, if the brain's registering that mean arterial pressure is low, it's going to try to increase sympathetic nervous activity, which is going to lead to vasoconstriction, which will help to increase total peripheral resistance, which will help to increase mean arterial pressure, as shown here. But then once that pulse pressure is restored, that firing, that frequency of action potentials returns back to normal, and then mean arterial pressure will then go back to its resting level. The level of vasoconstriction that occurs once sympathetic nervous activity has gone up can differ from vascular bed to vascular bed, meaning that some areas may be vasoconstricted more than other areas, and this may lead to redistribution of arterial blood in the body. And there also may be some variance between species as far as what areas of the organism's body ultimately gets vasoconstricted more than another. The medulla has a set point for mean arterial pressure. So an average mean arterial pressure is 93.3 across the population, but in those who have perhaps made poor lifestyle choices, who smoke, who have a poor diet, who don't exercise, maybe are just genetically disposed to hypertension, what we see is that because of chronic hypertension, there is a decrease in baroreceptor sensitivity and therefore a decrease in the response to changes in blood pressure. And so the reason why this occurs is because with hypertension, you tend to see an increase in stiffness of the carotid artery, therefore the carotid sinus, where those baroreceptors are. And then the artery becomes less distensible. And so it's going to have a less of a stretch response and therefore less responsiveness to changes in pulse pressure. And so let's say there is then an increase in pulse pressure. If your baroreceptors are less sensitive, basically what's going to happen is then the response in order to bring blood pressure down is going to be less. We also have a second group of baroreceptors that we are going to talk about today, and that is the cardiopulmonary baroreceptors. These are located in the vena cava, in the right atrium, and in the pulmonary vessels. And so they pick up on the low pressure side of the circulation. So they're picking up on pressures of venous deoxygenated blood. And so these baroreceptors are less talked about. Most textbooks only have a short section on the cardiopulmonary baroreceptors, if one at all. And so it's important to note that even though they pick up on changes in pressure and stretch on the venous side of the circulation, they are actually helping to regulate mean arterial pressure. So even though the changes are occurring within, again, the venous pressures, ultimately the response from the brain and the nervous system is going to impact mean arterial pressure. The cardiopulmonary baroreceptors will respond to changes in right atrial pressure or central venous pressure. And one of the instances when this is very important is the transition from supine to upright posture. If you remember, when we are lying down, our height of our feet, our legs, our torso, our head are all in the same plane, right? And so once we go from that position to upright posture, gravity is going to pull blood down towards the feet, including venous blood. So if gravity is pulling blood down towards the lower extremities, well then our central venous pressure or our right atrial pressure is then consequently going to decrease. And if less blood is returning back to the heart, well, that's going to impact cardiac output and therefore mean arterial pressure. So when this occurs, the cardiopulmonary baroreceptors will decrease its signaling of firing to the medulla, and then that in turn will pick up sympathetic nervous activity, which is how we're able to adjust to changes in posture. So again, because the cardiopulmonary baroreceptors are picking up on these changes in right atrial pressure or central venous pressure, we are able to regulate mean arterial pressure. To conclude, I made a little Venn diagram comparing the cardiopulmonary and arterial baroreceptors. Again, the arterial baroreceptors located in the carotid artery and the aorta and respond to changes in pulse pressure, the arterial pressure. The cardiopulmonary baroreceptors will respond to changes in right atrial pressure or central venous pressure, since they're also located in the vena cava. But despite these differences and picking up on differences in the arterial blood versus the venous blood, ultimately both are going to impact mean arterial pressure. And when there's deviations in either pulse pressure or right atrial pressure, they are going to impact autonomic nervous activity in order to try to restore mean arterial pressure. To summarize, the baroreceptors are what pick up on changes in pressure throughout the body. And we have these different groups of baroreceptors to monitor the pressures both in the venous side and the arterial side. Because ultimately, if pressures change throughout the body, that is going to impact mean arterial pressure, the primary regulated variable throughout the body, and that can impact then the flow of blood and the flow of oxygen to the different areas. So then the nervous system will respond to any of these changes brought about by what's called this baroreflex, and then help to bring blood pressure back to its set resting baseline point. Thank you guys so much for watching this video. I will see you in the next lecture.